Good evening. Uh, for my final project presentation, I have decided to do it on sickle cell trait. My name is Brandon Moultrie. This is for Professor Laura Cook, HPED 330, Care Prevention. The five W's: who, what, when, where, and why. Sickle cell was first indicated in 1874 in Africa. Sickle cell is a genetics disease found with people who are from the Mediterranean regions, Southeast Asia, Sub-Saharan Africa, including Nigeria. This disease comes about through the number 11 chromosome, in which its underdevelopment creates protein. It receives low oxygen, which then creates the sickle shape of the red blood cell. Um, Sickle cell is also called sickle cell anemia. From those who suffer from sickle cell, 45% of it come from sub-Saharan Africa, and out of that 45%, 2 to 3% come from Nigeria. Why is that significant? Because this is from early times prior to slavery, prior to the great migrations of different cultures, which leads to 8% of African Americans having it, and 10,000 Caucasians in the United States having it. As you can see through the picture, you have the red blood cells that look full and circular, and then you have these banana, half cut, balloon looking cells, which is actually represents the sickle shape of the cell. And I'm going to show you in a little bit why that is a problem. Those who suffer from sickle cell usually show signs within after the 6 to 12 months of being born. Some of the symptoms of sickle cell includes vaso-occlusive crisis is one of the bigger symptoms because one, it creates organ damage, but the body goes through a siege, as it will, and the cell causes great pain throughout the body through the damage to the organs. And then you have the microvasculature, in which the body also undergoes being deprived from oxygen, which is the second worst set of pain. Next is anemia, which the red blood cell lifespan is decreased, and because there's not red blood cells being born and growing and prospering, it creates low stamina because the red blood cells carry oxygen to the parts of the body. Microinfarcts, um, that has to do with the sickling of the blood cells, which affects the bones, the joints, the spleen, the kidney, the skeleton, the central nervous system. Other forms could be stroke, acute chest syndrome, pulmonary hypertension, renal disease, muscle cramps, rapid breathing. Those last two undergo more during exercises. Uh, if the oxygen is not being sent to the body, then the muscles will cramp. Um, Also, like I said, because of the stamina, you could expect rapid breathing because they are seeking for oxygen. Those who manage life with sickle cell take drugs such as hydroxide, carbonide, um, prophylactic antibiotics. They receive several vaccinations, blood transfusions to recoup the sickle blood cells that they have in their body and get fresh, hopefully circular blood, chelation therapy, and a Talfrin. Those who are health and PE teachers, these next couple slides will undergo um, how you can prevent, you can treat, and you can assess. When it comes to prevention, there's something called exertional sickling, which happens more during great amounts of exercises. The red blood cells sickle which causes a traffic jam within the body. Um, and because of the traffic jam, the blood cells are not getting to the parts of the body that needs oxygen, which can be a problematic. Um, if you want, you can set rules in which those um, players or your students can be screened um, and counseled if they have sickle cell or to see if they have sickle cell. You should not jump right into high intensity workouts, whether you're a coach or you're a PE teacher. All workouts, all exercises, all classes should undergo slow to high increased intensity. No time running, so that limits like pacer tests and shuttle runs. You should be just focused on maybe just having fun, stamina, but not time running. Uh, please allow breaks. You, the rest of your colleagues in the school should be informed of the disease and the kids that have the disease so that you could be well equipped to help them if they undergo a crisis. Be noticeable of the heat of the gym or the classroom, dehydration, high altitude asthma, and illness. Those are very important because they could be signs right before a crisis. High intensity exercises comes from those who may be undergoing football conditioning, basketball training, cross country races, track and field events, and boxing training or actual matches. I talked about traffic jam earlier in this presentation. As you can see through the top picture, the red blood cells are flowing through their veins and flowing through the different tunnels in the body very gradually and smoothly. But if you look at the bottom one, if you look in the top in the left corner, you see a smudge. This smudge is the cause of a traffic jam. As you see, the moon shape and the sickle shell shaped blood cells are collided with the circular shape, causing a traffic jam and causing blockage, which will then block the oxygen from getting to the body. Okay. Now, when it comes to treatment or returning to activity, you definitely stop activity if you see anyone having a problem. Check their vitals. Uh, you activate your emergency medical service plan, including CPR. You want to cool down the student or the player as quickly as possible. You should call 911. While after calling 911, call the hospital in which they will be going to inform the doctors that you have a sickle cell patient coming in, so they could prepare. Uh, if a student or a player wants to return, they must be cleared by a physician, and they now must have a return to action plan um, to make sure that they are gradually um, thrown into any type of high intensity exercises. When it comes to being a PE teacher, I must always have water available. Allow breaks. Have my own emergency action plan, which can include CPR training, or and if you have a sickle cell kid. I remember when I was in school, since my best friend had sickle cell, we always had a designated person that was told that if anything happens, like can go to the nurse, come to call her, or go to the office, or et cetera, et cetera. You can have a designated person. Your emergency action plan should be efficient based on your needs. Have your cell phone ready so you can call the hospital. If you are a school that or a place where it provided oxygen and oxygen tanks, you should definitely use those. Um, Blood pressure cuffs, stethoscope, to check if possible. What you see here are actual the articles found in the PIAA handbook for those who have sickle cell. Um, as you can see, they have their own section. Uh, this section starts off saying that no student with sickle cell trait should ever be disqualified. Simple precautions may prevent complications and sickling in athletes. It also states that all participating student athletes are required to provide confirmation of sickle cell trait status either through one existing documentation from birth or two. Let me go back. Or let's try to go back. Oh, or two recent screening. Most entering college age students have been tested for a sickle cell trait as a standard genetic screening at birth. At the next one, it says that all athletes with sickle cell trait will begin to develop symptoms including cramping, pain, weakness, fatigue, shortness, and breath. Should not exercise immediately and report to their athletic trainer and coach. Symptoms of suspected sickling can occur after 2 to 3 minutes of sprinting or similar sustained exertion. Right here are my references. These references vary. This is my presentation. Little backstory on why I chose this. Like I stated before, my best friend had sickle cell, and I actually was the person who had to bring him the stuff and watch him hyperventilate in a paper bag. This might have been October, and he didn't return to school until April or May of the same year because he had to undergo surgeries and blood transfusions and stay and be hospitalized. So I thought this was a good way not only to educate myself, but to share it. Thank you. Have a good night.